So when we work with our patients to select their implants, we have to consider two major factors, volume and profile. Volume is really easy for people to understand. It's what most people work off of, is I want this much enhancement of my breast. Most women will talk about cup sizes. That's really hard to work through because breast cup sizes are not really standardized from manufacturer to manufacturer, but volume is. So we can talk about a number of cc's or how much bigger you would be. Where it gets a little bit more tricky is when we talk about profile. Profile is a ratio between the implant's width, which we call the base diameter, and the height, okay, which is called projection. And it's not the height sitting on your chest, it's the height sitting on a table, or when you tip the implant, how far forward it's going to go off of your chest. Typically, the higher the profile, the more volume you're going to see coming forward. Now that can be advantageous if someone wants a rounder, fuller look, then we want a higher profile device. If you want a softer, more natural look, then we typically will have a lower profile. But we have to take into account three variables when we choose implants. One is the natural anatomy of the breast, how wide the breast is. That kind of sets us up to begin with, okay? Because you want to stay within a reasonably close approximation of what we measure the breast to be. Number two is the volume that you want. The more volume that you want, we have to figure out how to make it fit on that given diameter, and then the profile is the third part. So for a woman who wants less volume for a given base diameter, you might use a smaller profile, as opposed to somebody who wants more volume for a given base diameter, then we're going to go with a higher profile device. Basically, think about architecture. You have a single plot of land. If you want more square footage, you got to build up. Okay, so in the different companies, they have, some of them will have 3, some will have 4, some will have 5 profiles. Same thing, 1-story, 2-story, 3-story, 4-story, or 5-story building. The one piece where we have to be careful about is thinking that a given profile is going to give you a appearance, and that's not true. Nor is that true straight up for volume. How an implant looks on a given woman is an interplay between the device and her tissues. The same implant can look completely different on 2 different women, and so I'm really careful to kind of get an idea of what somebody is looking for aesthetically rather than whatever someone else's Instagram photo shows.